Okay, and I just wanted to do one more test. People can see the PowerPoint that says COVID-19 update, is that right?
Yes.
Okay, thank you. All right, one more reminder, please, to just put yourself on mute if you're not already. We are still picking up on some background noise. It sounds like things like stores closing, like somebody might be driving in a car. Try to think of all the other ways I can prompt people to self-identify that they might be the ones that are not on mute. So we appreciate your help with that.
Oh my God.
All right, guys. All right, let's try this again. Thanks for joining, everybody. So today, I apologize for that. I'm not sure what happened. I think maybe this software is also ready for a long weekend. So anyway, thanks for joining today. My name is Nicole Bahina, and I'm with All Chicago, and I'm going to kick us off today for our weekly COVID-19 update from the Homeless Service Division and the Continuum of Care. I'll be joined by DFSS and CDPH. And just a couple of housekeeping items. Please submit questions via the chat tool, and we'll respond to the questions after, well, we'll pause at a couple of key areas throughout the presentation to make sure we get to those. We always put a recording and a summary of this presentation on Slack. I think we're still doing the summaries. If they're helpful, we would like to continue those. And so if you get kicked out for today or can't really hear things or can't listen to the whole thing, don't worry, we'll catch you up to speed after the fact. And if you have trouble hearing, just try to switch between the audio options so you can listen using your speakers or dial in using the phone. And we will also try to help with any technical issues that come across in the chat box. I think I'll turn it over to Maura to walk us through the agenda. Great, and I might have to unmute Maura here. I see Dr. Jasmine's unmuted. Let me try to find Maura. Hey, yeah.
Okay, great. Okay, thanks. This is Maura McCauley from the Chicago Department of Family and Support Services. Thanks for joining us this afternoon. Our goals today are pretty similar to our usual format, sharing out updates from the city response and to ensure quality and complete information within our Chicago Homeless Services community. We want to hear from you all about challenges and gaps in COVID response in real time, and really just to continue to provide updates and build shared ownership of the goals and our collective plans for recovery. Next slide. So last week we previewed this big picture visual of the key components of our COVID response. We're continually working to strengthen this response in each of these buckets. Again, we won't walk through each of these buckets in detail each week on this webinar, but we'll provide key updates and important reminders within each of these buckets. And this will be something that we continue to evolve as we continue forward in this effort together. Now I'm going to hand it off to CDPH for updates on the current status of the pandemic and their updates on pieces of the response.
Yes, thank you. So for those of you who are new this week, my name's Dr. Jasmine. I'm a medical director over at CDPH. We usually begin by talking about the current status of COVID-19 in the city. If you want to review this on a daily basis, you can visit our website. The link is below, chicago.gov/coronavirus. As of yesterday, May 21st, there were 39,756 cases of COVID-19, and unfortunately, there were 1,830 deaths among Chicago residents. This represents an increase of 973 cases and 42 deaths since May 20th. Our numbers, they're continuing to downtrend. We're continuing to flatten the curve. And as you can see, despite this flattening, we're still reporting close to 1,000 cases on a daily basis. And this highlights the need to not unnecessarily have interactions that may expose you to contracting COVID-19. Remember that we are still under the shelter-in-place order, and just wanted to remind everyone of this fact as we enter the holiday weekend. And even after this webinar is over, I understand there's also a concurrent press conference by the mayor, which you can find on social media afterwards, that discusses plans for cautiously reopening the city. Next slide. And for those of you who missed yesterday's announcement at City Hall, I'm pleased to recap here that the mayor announced a new mental health supports initiative. I am one of the handful of medical directors here at CDPH, and we each have our areas of expertise. In the pre-COVID era, I work as the medical director for the Bureau of Behavioral Health, and this consists of 3 major divisions. One is substance use and recovery, the other is violence prevention, and last but not least is mental health. And this includes our city's 5 mental health clinics and organizations in the community that we fund. And yesterday we announced the funding for 4 community mental health organizations that provide community-based services for people with serious mental illness and other significant mental health conditions. And this is a major effort to support this team-based care approach, meeting the person where they are without requiring them to step foot in the clinic. The second announcement is that because of the shelter-in-place order, can you go back one slide? Yeah, because of the shelter-in-place order, encouraging social distancing and limiting exposure and close contacts with others to prevent the spread of COVID, many healthcare facilities have really expanded the use of telemedicine as an alternative to in-person visits. And in our CDPH mental health clinics, we followed suit. In the immediate need for providing teleservices, we started using telephonic services to provide teletherapy. And yesterday also was an announcement that we are able to provide this care digitally through a telehealth service that allows for video conferencing. And the platform is called Doxy.me. And it's available to anyone in Chicago who needs these services regardless of their ability to pay. It's free. And the third announcement is that we partnered with 10% Happier to create a free set of mental health resources. You can go to the next slide. And these resources include sleep aids, meditation guides, and talks as a resource to deal with the high stress levels that we are experiencing now. You can go onto chicago.gov/coronavirus and you'll see a link. A link going directly to this website is 10%.com/Chicago. And I advise you all to check it out and see what you can find useful from this site. Next slide. And so last week, just to recap, announced the opening of different CDPH-sponsored testing sites. On the left side of the page, you'll see there are additional sites that are open. Last week, I think at that point, there were only the first 2 sites that were open. And you'll see we have dates for when the other sites will open. And so currently, we have testing available in 4 locations. And the next site to be open on May 29th will be Kennedy King College. And basically, all these sites allow you to either drive through or walk up. And we advise you to sign up to pre-register before you show up, going to chicagocovidtesting.com. If for any reason you're not able to pre-register, that is fine. Just want to announce that on Monday, Memorial Day, the sites are all closed, so that won't be available on Monday. But in general, it's open Monday through Friday, 10 to 4. On the right side of the page, these are additional testing sites identified by the Illinois Department of Public Health. If you go onto IDPH's website, you can search for your closest site using your address. For the testing sites recommended through IDPH, I do recommend that you call ahead of time to make sure that you are actually, in fact, able to be tested at that site. Some sites may require you to be a patient of the site before they test. So just call for clarification before you show up. Next slide, sorry. And also, as a recap from last week, some of the testing strategies in shelters, because I know we've had many questions about this. We have partnered with Rush University, UI Health, and others such as Mondale Christian Health Center, Heartland Health, to provide this rapid testing support. What happens is that if a client and staff who are symptomatic and we know there are positive cases in a location and it's reported to us, then we contact the location and then arrange for testing for those who were in close contact with those who we know to be positive. On the right side of the page, you'll see the link where you can report positive cases that if your site has not had a rapid testing team. By clicking on that link, you'll report the person's name, and then we'll contact you to try to arrange these testing services. In addition to having the rapid testing team come to your site, we're offering personalized case-by-case guidance for your congregate setting. We'll provide a nurse to come and review the results when they return to the shelter. And then we'll help with referring to isolation facilities if isolation is not able to take place on site. And they'll give further guidance on infection control practices. We also will provide results to DFSS and as well as the designated shelter representative within 1 business day of the results of being reported. If you go to the link on the bottom of the page, it'll review what so far our testing data that we've been able to gather. And if you go to the next slide, here we've also had some questions about what kinds of tests are we conducting or using during this rapid testing. And here you see there are two different kinds of tests. So one is called the real-time reverse transcriptase polymerase chain reaction. It's a mouthful, but basically this is the standard test, what we call the gold standard test for testing. And what it looks for is genetic evidence of the virus. It's more sensitive to the presence of the virus, but the results are not immediate. It may take up to 2 days for the results to return. Right now, we've become more efficient for widespread testing. We could batch large number of specimens. Initially, a few months ago, they were taking maybe 5 or 6 days, up to 4 or 5, 6, 7 days for the results to be reported. But now we've improved, and we're looking for further improvement in the turnaround times for the results. In the middle, you'll see just a reminder of what the DNA double helix, and then RNA is basically a single-stranded version of DNA. This is what the test looks for, these little genetic pieces of evidence for the COVID-19 virus. The rapid test is that we are using. It's called the Abbott ID Now. It also looks for genetic virus evidence, these RNA pieces of RNA strands, and it's ideal for people who are currently symptomatic. The idea behind that is that if you have symptoms that if you have enough of the viral load in your body to cause symptoms, then we're more likely to, once we get the specimen, usually through the mouth or the nose, that we're able to test and find this genetic evidence of the virus. One thing to note is that it is less sensitive to the presence of the virus, but we are able to get the results within 15 minutes while we're on site, while the testing team is on site. Because it's less sensitive, it's not as ideal for widespread testing. It's about 4 per hour, so we can only test one at a time, so 4 people can be tested per hour. So that's part of the downside, whereas the standard test can be tested in large batches. Okay, next slide. Some of the results from the testing as of May 10, we've tested 1,853 shelter residents and staff, and this occurred in 27 programs across Chicago. 471 shelter residents and staff have tested positive for COVID-19. On average, the percent of people within a shelter who test positive for COVID-19 is 25%, and that's similar to the results we've seen in other major cities. However, in the past month, like in late April, early May, Chicago's average percent positivity rate in shelters with at least one reported case is below 15%. And we tend to see lower positivity rates in shelters in repeated rounds of testing. And so this is a good sign, indicating that the efforts to stop transmission within the shelter were effective. And if you want, as we update this information, you could find the updated reports, the test results, using the link on the top of the page. Next slide. Okay, here, this is de-identified information, meaning the shelters, the specific locations of the shelters that these results represent. The names have been removed. But just to give you an idea of the wide range of positive results that we've seen in different locations, let's start with the left side. Each horizontal line represents an individual shelter. Red represents the positive cases and blue represents the negative cases. You'll see that there are some locations where we've had close to 60% of people tested positive for COVID-19. As you go down each successive line, you'll see there are also some locations where we've had a very low percentage of people who tested positive. Even the last 3, there are 3 locations where everyone tested was negative for COVID-19. And that's just to give you an idea of the wide differences we're seeing. And then for the final weeks in April, early May, we've seen a percent positivity rate of that's been below 15%, and which means, again, that we're slowing the rate of spread and we're seeing decreased outbreaks because for all of the hard work that you've been providing in implementing infection control practices, wearing your mask, washing your hands, cohorting those who are sick together, separating them from the healthy people, staggering meals. Just want to say thank you for all of your hard work. And One more thing, if you're unable to take some time off during this 3-day weekend, I do advise you to try to take some time each day for some self-care. What does that mean? 5 to 10 minutes of meditation if you're able to. Even if it's a deep breathing exercises. If you like to read, try to take 15 minutes to read something, hopefully not related to COVID-19, or even something as simple as walking around your block to take your mind away from your work. Thank you. If you have any questions, I'll be happy to answer them.
Thank you, Dr. Jasmine. I have a few questions here about testing. So the first question is, are the testing sites open to any Chicago residents? And then along with that, how quickly are results returned?
So the Chicago Department of Public Health testing sites, those 6 sites on the left side of the slide that I had before, they are open to all Chicago residents. The results should return within 2 or 3 days. And they're usually returned, if you have an email, the results are emailed to you, or if you don't, we can call. For those who have neither, I think you're able to go back to the testing site to get the results.
Okay. Sorry, I'm refreshing. Okay, so is there any plan or possibility to have testing provided for new intakes at shelter facilities?
Oh, okay. So that's not automatic. I think some of the guidance for testing at a facility, let's say we've already been to your facility. If there is, I guess, less than 5% positivity rate, it may be harder to get the testing team back to your site. So we're limited in the number of people who can conduct the test, and there's also increased needs. So the team that's going around to each of the shelters are also going around to our nursing home, long-term care facilities, and so we're limited with how many sites they can visit per day and during the week. So it may be harder.
And then what are the false positives, negatives for each type of test that you shared? Do you have that information?
I would have to follow up with you. I do know for the rapid test, I don't have numbers, but it is get better results if you're symptomatic when you're being tested. But I could follow up with the exact percentages.
Okay, and then for the standard test, how long after exposure would the test likely pick it up?
So that's also a topic that's been discussed in the literature as well. There's no hard and fast answer, but the general consensus right now is about 4 to 5 days after exposure. But again, we're still learning about this, so that's not a hard number.
Okay. There's a question around, protocols followed at shelters with 0% positivity, and whether some protocols were not able to be followed at shelters with higher positivity rates. Are you seeing any correlation there, or is this something that's really kind of dependent on, who's in each shelter and their outside exposure as well?
Yeah, that's a very good question. I'm not sure how much follow-up we've done once we got the results to see exactly how the protocols were implemented, either successfully or unsuccessfully. I would have to follow up with you on that.
Okay. There is a question first, excitement about the mental health initiative And then a question around how limited minutes on government phones might impact telehealth options. Is that something that CDPH is thinking about?
Mm. So for cases like that, we do have in-person services available. But in terms of increasing minutes, I'm not sure how much the city would has the, I guess, authority to work with the federal government to increase those minutes. But the alternative is in-person visits. Our clinics are physically open, and that could be one reason why, if and it's available for people who are unable for one reason or another to have telehealth services.
Mm-hmm. And then I think the final question is, how can shelters help their shelter guests access the new mental health supports? Will there be more information coming about that?
Yeah, so that's not fully developed. At least as a baseline right now, you can always go to the Corona website and then call our clinic. At least on the telephone, we're available. How we would get the video conferencing into the shelters, that's another, I guess, another problem we need to work on.
Yeah, so we'll have more updates as this becomes more fleshed out and ready for implementation. Okay, I think that is all the questions that I'm seeing, Dr. Jasmine, for CDPH, so thank you.
Yeah, thank you.
Okay, happy to move on to DFSS updates. As it relates to shelter decompression, as you know, the city has opened 5 temporary sites providing 700 beds for COVID response. As we prepare for phase 3 of cautious reopening, we wanted to provide you kind of an update on what we are hearing from CDPH as the ongoing need for shelter decompression and how we are thinking about the temporary sites. CDPH has indicated that we need to be thinking about shelter decompression, for a longer time period. And so we always knew that these temporary facilities would be temporary. We had partners who stepped in a moment of crisis to help us quickly open shelter facilities. But some of these partners will begin needing their facilities back as the city moves toward reopening. So DFSS and our Emergency Operations Center, a whole team of people, are working with the facility partners and then the shelter managers, where we have delegate agencies managing some of these temporary facilities, to plan for the next phase of our alternative site footprint. So there's not a lot of new information at this point, except to say that we do anticipate, an ongoing need for these temporary facilities to support shelter decompression. The first transition will be happening this weekend. We'll be moving one of our facilities at the Kroc Center, which serves women and families, to a new location over the weekend at Calumet High School. We are really taking some of the lessons learned from the congregate sites, taking some additional guidance from CDPH to be able to group people in smaller spaces within classrooms, still maintaining social distancing, but really thinking about what all of, our entire shelter system has learned in terms of making shelter space as safe as possible. So those are some of the new opportunities that we're looking at with new facilities. And again, these are still temporary. These are not additional shelter beds, but really maintaining our current shelter footprint as long as we need to continue social distancing. we'll have more conversations about that as those plans evolve. In terms of shielding, Lawndale Christian Health Center continues to shield clients who are at high risk for COVID at Hotel 166. They are feeling that they have shielded some of the most high-risk individuals in our shelter system, and continue to hear from shelters about additional folks who may come into the system and need shielding, and we're working to determine opportunities for that group. We can move on to the next slide. Sorry, I just lost my place here. Okay, as a reminder, we are continuing to take referrals through 311, and so, just a reminder to continue reporting challenges to us, including these important details via the DFSS Homelessness City of Chicago email, so that we can continue to work through issues with 311 and Catholic Charities during our weekly check-ins. Again, that's really important and helpful to help us understand in real time where improvements or gaps are. Next slide. So we are really excited that we have been working with CDPH, medical partners who are involved in testing, and outreach teams to put a plan in place to begin testing in encampments. We are hopeful that we will start next week. There are some logistics that need to be figured out with our outreach partners and the testing team based on the comprehensive needs of the homeless system, but that is set to be piloted moving forward, hopefully next week. And as we move that forward, we'll provide more information and updates on this webinar. This is clearly a need that we've all been thinking about during this response, and are very grateful to all of our partners to come together to start adapting our shelter testing protocol to make that available to individuals who are unsheltered. And then we are continuing regular outreach during this crisis, focusing on COVID-19 awareness and response. Next slide. So a few weeks ago, we talked about the availability of thermometers through an amazing donation from Rush. And we're excited to share that we've cut through some bureaucratic red tape and are now in a place where the thermometers can be distributed to DFSS funded shelter and outreach providers, and I believe some additional providers as well. Volunteers are being organized to distribute and train staff on thermometer use, and communication and exact times will be forthcoming. They're anticipating doing this next week, so keep an eye out for that, and feel free to reach out with any questions. Next slide. As we shared last week, the DFSS RFP has been canceled this year, and contracts will be extended through December 31st, 2021. You should have, if you're a DFSS funded agency, you should have received official notification from Commissioner Morrison Butler. And if you have any questions, please let us know. We're just reiterating this message to make sure the word is getting out. And I will now pass it over to All Chicago for additional updates.
Great, thanks. We just have a couple of slides to share today. So in June, which is right around the corner, All Chicago will be coordinating an effort on behalf of the COC related to our Expedited Housing Initiative, which we've been talking about a lot on prior webinars, focused on people who are residing in that Shield Hotel that Maura talked about earlier. So we're going to be focusing on that Shield Hotel, also known as Hotel 166, and we're going to be using a cohort model. So coordinated entry prioritization has been shifted so that we can really focus on these residents. We've been talking about that for quite some time on this webinar, and now this cohort model is where we'll be identifying people, helping them complete documentation, choosing a unit, and arranging furniture in a very, very short period of time. So this should be starting in June, and we're still working out the final details and communicating those and finalizing things with Lawndale Christian Health Center, which we'll be working with closely to help focus on this, and we'll be able to share more details just to the extent that it might be helpful or interesting to people in the coming weeks. And then we are also working with our existing rapid rehousing providers and housing system navigators to help households move into a temporary unit, like I said, within a short period of time. And in that temporary unit, they'll receive services and work on a long-term housing plan. So just another visual or way to kind of process this information is the household will move into a temporary unit, which will be in almost all cases a scattered site unit out in the field, and we'll be then working with a rapid rehousing case manager to develop a housing plan. So it looks very much like our Bridge program, which we've had operating in our continuum of care for some time now, but we're just going to be expanding and scaling it, kind of starting with an initial small surge and then hopefully expanding it beyond that as additional funding becomes available. Some of the people that are going to move into a temporary unit may not move again. Maybe that unit becomes their continuum of care permanent supportive housing scattered site unit. Maybe that person is able to connect to an income source and is able to assume their lease, kind of like a more traditional rapid rehousing model. And then some will use this as a true bridge as they're waiting for a CHA voucher or to move into another unit with a different subsidy. So this will impact those of you that are taking requested people through coordinated entry, so the matching process. And again, we've shared some of this information, but we're just getting into a little bit more detail here. So we can share that, starting on May 11th, all new matches were for people in Hotel 166 based on the temporary coordinated entry prioritization plan. So if you were already matched to somebody before this, they may not have been in Hotel 166. But if you received a match after May 11th, then that person is coming from Hotel 166. If no one from Hotel 166 meets a project's eligibility criteria, then we'll send an additional eligible match using the old prioritization. For rapid rehousing providers specifically, we're going to be working with you to match people soon, but hopefully before they move out of the Hotel 166 and into a unit. And then for PSH providers specifically, it's highly likely that people matched to PSH will already be housed in a temporary unit through the Expedited Housing Initiative. So ideally, these folks will only need to move in if they're matched to a site-based permanent supportive housing project. And with that, I think we can pause and just see what questions have come in before we do our traditional wrap-up slides. I'm going to stop sharing my screen because I can't both share and see the questions, so give me a minute to kind of process those. And Maura, if there are any that were directed at DFSS that you want to jump in with first, please feel free.
I'm also processing. There's a question around if someone tests positive, how can they access isolation spaces? If somebody test positive and they are, you know, in the shelter system or working with a homeless service provider, there is, CDPH has been working with their nurses to help make referrals to isolation facilities, but there is also a centralized intake process where referrals can be made online. They do require quite a bit of medical information, and so working with a medical provider is easier. But you can also, you know, reach out to us if you have any questions about that. CDPH has been very supportive about helping troubleshoot situations where people need to get matched to an isolation facility. Typically for the general public outside of the homeless system, the referrals can be made by medical providers. And then, Erica, you also have a question around, you know, whether somebody who tests, if a street or encampment-based individual tests positive, whether they will be required to accept an isolation placement. I think that's one of the logistics that the team is working through, but at this point in time, you know, isolation is not mandatory, so that will be a consideration that we need to work through.
Thanks. And David, thanks for your question. So David asked, can you discuss more about the temporary units and their transfer to a PSH provider if a client is matched? So I think there's two things to note. Some people who are in the Shielding Hotel site were already on their way and or matched already to a permanent supportive housing provider. And in those cases, we are just trying to help expedite those processes as quickly as possible. So some PSH providers may already be receiving people that had an experience at Hotel 166. If somebody is not currently matched to a PSH provider, the goal would be to help them achieve a bridge unit placement and then look at where they fall on the temporary prioritization plan to figure out what their housing path would look like. If it so happens that the person would fall into the group of people that are likely to get into a permanent supportive housing unit, then their bridge experience would be that they stay in that bridge unit until we can transition them and a subsidy becomes open at a PSH provider. So hopefully that answers your question, and we can get into a lot more details maybe at the next webinar too, where I can invite Karen Cole, who's the project manager and knows a lot of the actual, you know, she's in it on a daily basis, and so I think we'll share more information as we go too, but please put in the chat if you have additional questions about that. And then Michelle asked, will this expedited housing use traditional rapid rehousing time limits, and what are the plans that tenants won't return to homelessness? So thanks for that question, Michelle. I mean, of course, there's no promise that somebody won't fall back into homelessness, but the goal with the bridge units is that somebody can stay in the bridge unit until a permanent housing path has been achieved. And so with the rapid rehousing bridge model has case management services that are very housing focused for this specific purpose. And then we're also hoping to leverage some of the behavioral health supports that were announced on the session today and make sure that clients are connected to a lot of different opportunities to help their experience be successful. So I hope that answers your question, but feel free to chime in more in the chat if there's further questions. So maybe while people are thinking and typing, I'll just go back to sharing my screen and we can get through a few more slides and then do another check in the chat to see what additional questions there are.
Okay. As we look ahead to the stay-at-home order ending at the end of May, which is next week, as a reminder to all of us, as time seems a little it's going by really fast and slow at the same time, but it is next week. We want to make sure that you are aware of a whole range of resources that are available to help you plan. So as we've mentioned on every webinar, you can continue to stay up to date on the latest news and guidance related to the COVID crisis by visiting the city's COVID-19 website. All public health orders are also detailed on this site. And as employers, we also encourage you to review the public health guidance for businesses and employers to help you plan for more of your staff safely coming back to work. If you have staff who are working remotely or, working in different settings than your normal course of business. And we're really interested in hearing from you about tools or guidance that would be helpful for you, your staff, and your residents that you're working with as the city moves into phase 3 of the reopening plan. So please, if you have thoughts now, feel free to put them into the chat, and we'll track them there, or feel free to email to the DFSS homeless email. This will just help us approach the ongoing support and tools that we're able to work to provide as we all move forward. So as we always say, we will continue to use these weekly webinars to provide updates and continue our information-seeking efforts. But again, these aren't the only ways that we communicate. All Chicago uses the Slack channel, and these presentations will always be posted there. So if you miss them or you want to share them out to other people on your teams, please check those websites and those resources for additional updates to circulate information broadly through your organization. Please continue to keep DFSS informed about any issues that you're having with staffing shortages, changes in bed availability, especially as we're, maintaining the decompressed shelter footprint. Bed availability changes daily, and we are working really to make sure that Catholic Charities has all of the information that they need to provide a placement whenever somebody requests one. So that's really important and appreciated for our shelter providers. And again, please continue to also share suspected or confirmed COVID cases with us. But as we evolve the testing strategy and have really formalized partnerships between CDPH, the testing team, and our shelter partners, you should use the CDPH, reporting process, and we are getting reports back from CDPH as well. So that's really just to keep us posted so we can support you as you need related to those cases.
Thanks. So yeah, we will post the webinar summary slides and a recording on the Slack channel within 2 business days. So if you haven't joined Slack already, I feel like we should do a poll of is there any one person left not on Slack? And then if there isn't, we could probably take the slide out. But we've been so appreciative of everybody's participation on Slack and joining there, and are really interested in looking at how we continue to use this community that we've created in an online platform for the rest of our time during COVID response and recovery, but also beyond. So thank you for helping us test a new experience for the COC in the way that we communicate. And I'll just take one more minute to box quickly. I think, Mary, you asked a question of how many bridge units are dedicated to families, and I'll have to get back to you on that. I'm not sure. We actually don't have, the units themselves are not specifically dedicated. So we're really about serving the households. So right now it's about how many families are there in that shield site, and that I don't know the answer to off the top of my head. The way that we are using the subsidy and doing our centralized landlord engagement that we've been talking about during these sessions means that we have relationships with landlords that have units of any size, and the rental subsidy can cover units for any size. So it's really about matching the unit and the subsidy to the household size. But I don't know offhand the number of families that are in this first cohort. Maura, from your perspective, are there any other questions that need to be answered or that can be answered that we haven't gotten to already?
I saw a question from Betsy asking if we will continue or not to continue asking shelters to operate 24/7. And at this point in time, we are still asking emergency shelters to operate 24/7. So we will continue to evaluate that as the reopening happens and as we monitor this next phase of the pandemic, what that ongoing need will be. But we will have advanced communication about that as that changes. And then Michael is asking a question about how CDBG or ESG funding will be spent, and that, that is, the city is going through its budgeting process right now. There have been many recommendations that have come in from the COC and other partners about how this stimulus money should be spent. And so I'm not able to speak, specifically about that. But ESG is, for those of you who aren't familiar, has some pretty specific categories of funding, and those are around homelessness and, homeless shelters and outreach, homelessness prevention, rapid rehousing, HMIS, and administrative costs. And so we have been, working in coordination with the COC to formulate the funding recommendations that DFSS put forward about how we would recommend these funds be spent. And so we are, going through the city's process. And as I think was presented last week, there will be a substantial amendment released with a 5-day public comment period in June. And so we'll be able to share more information once that notice is provided. But do appreciate everybody's advocacy and all of the feedback that we're receiving to help us formulate those recommendations. And again, I think we've also talked before that we're really grateful that we have a strong homeless planning infrastructure within our COC, and our goal is to not recreate the wheel with stimulus money. We hope we can use it to be innovative where possible, meet the really critical needs that are coming out of this pandemic that have highlighted some of the gaps that we have in our system, but really use it to move forward the plans that have already been laid out to meet the needs that were identified and only magnified by this crisis. So that's really the lens that we're taking in our planning. And there are very real costs to this crisis. So those are the things that are being balanced in these recommendations across city departments and with the city overall. And I see a question from Audrey about encampments, and I'm going to have to follow up with you offline on that because I will need to see what was said on the press conference. But I do see that, so I want to acknowledge that I saw your question. and we'll look into that. And I think that's it for me, Nicole.
Great. And I'm not seeing any other ones that are addressed to All Chicago. So thanks everyone so much, and we will catch you all next Friday. And in the meantime, if you have any thoughts or questions about what types of information you wish you would hear from All Chicago or DFSS or CDPH on the webinar, feel free to send that to cocprograms@allchicago.com or .org, sorry. We'll put that in the chat. I was just thinking about how these webinars are so great, and the questions really help drive the communications that we have ongoing, but a lot of times the questions are just reacting to the information that's shared, and there might be something that we're missing. And so to the extent you have anything that you want to hear from us that you haven't been already, we would love to make sure we address that. Thanks, Jennifer, for putting that email in the chat. Great. I hope everybody gets a little bit of rest this weekend, and we will catch you next week. Bye.
Thank you.